My teaching time is bought out by Hurdle Health, and on your desk you have a report that we conducted. This is our second year of the report, and it's following George Floyd. The first year we talked about the impact of mental health on African Americans. This year we talked about vicarious racism. We called it vicarious racism. It is vicarious trauma, but racism. When we think about racism, we as a people, we've got to stop thinking about racism as a generic term. We've got to look at it as it impacts different groups differentially. So when we look at, each minoritized group in this country, they've been impacted differently by racism and discrimination. So we look at Native Americans, we look at their connection to the land, we look at the pipelines that are being built through sacred property that has, sort of a disproportionate impact on them in ways that it doesn't impact other people. We look at the missing and murdered Native American women. We haven't had enough national conversation. When we look at Asian Americans, they are pitted as a model minority. And when you have a group that is a model minority, you make the assumption that every individual is perfect. I teach in a counseling program, and we have several Asian students. And one of the things they'll always say to me is, Dr. Devines, every time people look at me, they think that I'm supposed to be gifted in math and science. And I'm not gifted in math and science. There's a great book by Jamie Liu called Asian Americans in Class, and she looks at second generation Korean American individuals. And she looks at the different developmental trajectories that the children have as a result of their parents' occupations. If their parents were merchants and they owned their own businesses, they were able to give their children access to opportunities and resources. If they were employees, they worked 16, 18 hours a day, and they weren't able to provide resources and opportunities for their children. Because who's going to do homework when their parents at work? And nobody's there to monitor it. And Asian Americans have been targeted disproportionately in the pandemic. When we think about the Latinx community or the Latino community, one of the things we think about is the issues around language. We think about the issues around immigration. When we think about African Americans, we think about state-sanctioned violence. So each group has its own cross to bear as it pertains to racism and discrimination. So that's its relationship to white supremacy. When we think about this in a mental health context, there's a section in the paper that sort of deals with this. We need to go back historically. We have this impression in the United States that, once slavery ended, everybody was on the same playing field, but everybody was not on the same playing field. The pathways were very different. And when we look at it in the context of mental health, we have to go back to psychiatry. And we have a section in there that talks about early psychiatry. Doctors early on, during the antebellum period, did not have a lot of credibility the way they do now. They weren't saving lives. And so one of the things they did is they staked their reputations around slave medicine. So they came up with these made-up diseases: drapetomania, runaway slave disease, cachexia africanus, dirt-eating diseases. And you treat runaway slave disease by, being brutal. And when we think about early psychiatric facilities in the Deep South during the antebellum period, there was differential treatment. People were scientists were very committed to determining a racial hierarchy with groups. In the same way that Carl Linnaeus focused on plants and animals, he later focused on the racial hierarchy. Because if you create a racial hierarchy, then you can justify any kind of mistreatment, because the people at the bottom are seen as non-human. And so when you go back to these early psychiatric facilities, one of the things you'll see that Black and white patients had similar kinds of diagnoses, but they were treated very differently. Whites needed idyllic conditions to heal. They needed to have music and arts and books. But guess what Black people were thought to need to heal? Huh? Oh, yeah, please say it. Please say it. Pretty much. Occupational therapy, so they can assume their position, sort of later on. And it doesn't end there. After slavery, then we see the eugenics movement, where the testing goes on, and then we decide who is normal and who's not normal, and who's worthy of reproducing. And it sounds similar to what's going on right now. Who's worthy of reproducing and who's worthy of not reproducing. And then when we move up to the civil rights movement, we think about all of the Black men that were corralled in mental health facilities or psychiatric facilities because they were protesting their civil rights. So when we think about white supremacy, it has deep roots, and we can draw a straight line from the past to the present. And one of the things we need to do is think about how we are going to dismantle these systems of oppression that still have their grips around every group in this country, even though the way the grip is, it looks different from group to group.
The third question that I'm going to give you to discuss, actually, you have just taken us partially down that road in your answer. And that is, what would you establish as the preeminent structural, historical, and present-day barriers to the provision of mental health care in minoritized communities? And what is at stake if we do not address these barriers?
I think we have to start with ourselves. We have to acknowledge that unless we do the work that we need to do to address any kind of implicit bias, any kind of prejudice that we have, which we all have. We all have prejudice. We're all sensitive to discrimination because we're a product of where we grew up and by whom we were raised. So we are acting out, and unless someone tells us that there's something wrong with that, we're going to keep doing the same things, right? But once I know, so if I'm in a room and somebody says something inappropriate or racist, right? And I approach that person and I truly feel, boy, they really did not know. And I know that can happen because I've met adult white men who never saw a black person till they went to college, right? So that still exists in this country. But once they know, then there is no excuse. Then it's their responsibility to act different, to behave different. And when I attend these forums or whatever other workshop or book that I read, and I learn the truth, I learn the history, then I can no longer stay silent. Then it's my obligation to speak up whenever I'm in a place and something gets said that's not correct, that's inappropriate, or that is racist. So if we don't address these issues, because usually we continue to repeat this behavior, right? We have a horrible tragedy, and all this attention goes to it. But then the policy and procedures never change. So things will go back to the way they were going. So unless we do that, and the only way we can do that is by standing up every time we're in a meeting and says, this is not correct. We need to change this, right? And we can do that collectively. So when we look at, racialized oppression on health, and health, physicians, psychiatrists, they were part of the problem. Diagnoses were made based on your race, your ethnicity. They were making up diagnoses just to make sure that that person was not going to be able to move forward. So if we don't act on this, it's going to continue to happen. And who's going to be hurting? The communities that are not getting the help now. We're going to continue to see the health disparities. We're going to continue to see black and brown people die younger and have worse health problems than the rest of the country.
So when you look at things like, and this is where you can't ignore the historical aspects, when you look at banking, for instance, and differential for loans for different populations. This is a great example where I remember the first time I heard about that, I said, that can't be true. Like that's impossible. And then you find out, oh, it is. And by the way, this wasn't that long ago. I'm like, oh, I'm not that old, but that's a challenge, right? So so you have, those very real aspects. I mean, we can go back from antebellum period to moving forward. You have different laws that look at things differently. And you look at voting rights and voting districts and how those are set up and gerrymandering and all that impacts in terms of some of these larger structural concerns. You look at other things too in terms of, we've hinted at this as well, but differential rates for incarceration, for how different things are impacted. And there's lots of arguments about why that might be, but you can't ignore the fact that when you just look in those facilities, is definitely primarily filled with individuals that are people of color, right? And so, and then again, I work in these institutions, and so when I look around, this isn't just pie in the sky, this is definitely every single day. You look at other aspects too, looking at from our educational system and how things are done. You look at how the educational system will deal with different types of behaviors, and also how this, unfortunately, will be more likely to negatively impact minority populations. So this, Johnny or Jane did X, Y, and Z, we're going to suspend or expel them, versus, oh, well, they were having a bad day, and how that impacts. And if you can't even have that educational foundation, how will you then be able to move forward in society and then be able to be the person that you want to be for the next generation, et cetera, et cetera. And so there's a lot of these different sort of major systems that go into place, and we've hinted as well in terms of access to things like either good quality, just general healthcare, or access to things like food. You have food deserts, et cetera, where folks can't even if they want to be healthy, they can't be because it's not safe, or there's not supermarkets around, et cetera. So these are these major systems that if we only focus on one or two things, we won't be able to really move the dial to where we want to be. And then also, like we're doing here, advocacy and having people, you're mentioning, just if you're in the room, but you have to actually speak up and not to be complacent to things.
And in my role, I'm the director of youth programs. I work with a team of youth peer advocates who go into the schools. They offer presentations about mental health. They run skill building groups. They do one-on-one peer mentoring. They are all young people between the ages of 18 and 26. At least my team is. To be a youth peer advocate, you can be between the age of 18 and 30. But they are able to sort of meet the students and the youth where they're at. They work with students anywhere from ages 9 through, well, we have even, we call it 20-something support group, basically. But they work with people that are peers. We say peers, like similar to their age. So I think about, from that context, the future. So that's really what's at stake for me in my world. I think about how so many youth are struggling. I mean, we hear about the school to prison pipeline. That is yet another example of what is in place and what's facing many of our youth today. So I think we also have to consider how we take that into effect. So when I think about the idea of where we're going, I'm really concerned. We're already dealing with an issue of the pandemic, how it has affected youth in terms of their education, how it has affected the ability to learn, how it affects their social connections. I mean, the last 2.5 years have greatly stunted and arrested their development in all kinds of ways. And I mean, I will say I'm the father of 2 adult daughters. And all I know is that if I had to go through what many people have gone through the last 2.5 years with my daughters, I'd be probably thinking things more intensely because of what I've seen with those with whom I work. So I think about those consequences, about the youth of today and what they're facing. The idea of, once again, access to care, the idea of how poverty affects youth, how access to education, how access to healthcare, all these things we're talking about, but specifically with our young people, because that is the future. And unless we start doing these things like changing policies and changing the way that we're doing things, our future is at peril.
It's a travesty when we think about the fact that the demographic composition is changing, that within the next 10 to 20 years, ethnic minorities will constitute a numerical majority. And how can you not know some of these issues, how suicide impacts different groups differentially? The African-American community, suicide is considered taboo, and suicide is underreported in the African-American community. Because if you are connected culturally, you're going to do what you have in your mind to do, but you're going to do it in ways that don't violate cultural norms. So when we think about suicide by cop, or we think about engaging in self-injurious lethal behavior, that may be more acceptable than, say, putting sort of a gun to your head or your mouth. So sort of understanding, sort of what different issues look like. Within communities is important. Legislation is important, and everybody in here can do something, say something, petition our legislators. One of the things I would say, if you haven't already read it, Cheryl Cashin has a good book called Black Hood, White Space, and in it she talks about resource hoarding. And when you look at communities all across the country, you can see where there's a pocket that is segregated, that gets absolutely no resources, same funding streams, but gets absolutely no resources. And that's resource hoarding, because you have a dominant group that is getting the best transportation system, the best water, the best, sort of access to every resource, but minoritized groups are not. And we can name cities all over the country. Larry Brown wrote a book called The Black Butterfly. I work in Baltimore, and Baltimore, there's East Baltimore, West Baltimore, and then there's right down Charles Street is where the affluent people live. All of the resources go there. Same city, same funding stream, all of the resources go there. Our governor was supposed to be putting a transportation system so that people, primarily minority individuals, could get to and from work. A 15-minute drive to work takes 45 minutes. Scholars call that transportation detention. I mean, so, how does that impact getting to and from work if you have to take 3 or 4 buses to get there?
As you were just discussing, what do you see as concrete legislative policies that need to be pursued in order to address specifically the mental health inequities as you see it?
So some of it we see already happening, but legislation that would provide training, specific training in minoritized communities to work with specific issues around minoritized individuals. So it's definitely the legislation for resources and funding to eliminate mental health care. And then the Mental Health Parity Act, we should be reimbursing physical health and mental health similarly.
The one actionable step that any state can implement right now is in their licensing procedures. They vary by every state. In Georgia, for example, if you're licensed in Florida, Georgia won't give you reciprocity. But if you're licensed in Alabama, they will. Makes no sense. Well, there is this need for clinicians. Before the pandemic, we had 250,000 clinician shortage. That number has tripled. We need clinicians. If you speak another language, or if you have limited English proficiency, there is even less clinicians available. But we do have foreign-born professionals in this country that we do not allow to work as clinicians because of those same policies and procedures that the licensing boards have. For example, in some countries, an internship is not required. But here, if you don't have an internship, your application is not moving forward. So they're asking foreign-born professionals to go back and get a master's degree here, which can be cost prohibitive.
In terms of if you're thinking like basically from the womb, how do you improve parenting skills for especially when you know that there's going to be certain populations that are going to be more at risk for various type of traumas? And there's been research and different types of programs on this for decades, but again, funding. So this is where the legislation part comes in, funding for those programs. Prevention's not very sexy. We don't want to really necessarily pay for something you're going to see the result 10, 15, 20 years down the line, and yet that's where you not only get good bang for your buck, but it's also a good place to start with things. So that's from a more of a population standpoint. At least within, how can we maybe improve the mental health for folks that are disproportionately affected, and also be able to have them have more access to individuals that are either more like them or can have some of that shared lived-in experience. You can start with things, and all these types of things have been done to varying degrees, and maybe again legislatively is trying to think of how to coordinate this and standardize it, where you start from grade school on up, and so you have it so that kids start to have more curricula in terms of learning about mental health, just emotional awareness, self-soothing type of things, risk for substance use disorders and how to prevent it, helping empower and just make it standardized. Again, sort of like everyone's health class that is plus minus how good those can be sometimes, right? But at least if you have as the concept that it's treated as equal as anything else and as important as any other type of information, then that can be useful. And then as you keep going on up, so you have to also create some level of incentive for folks to even want to go into a mental health field. So that's where you get them young. So you try to incentivize and create programs, whether it's a mentorship type of program or at least exposure for high school kids that might not even be able to necessarily complete school, let alone go on further in schools. So how do you create that type of programming? And then once you start to get to the collegiate type of environment for the folks that, again, might be able to have more knowledge or understanding these type of things, you give them even more information in terms of culture. I love the discussion earlier about cultural competence and how that really, this term we use a lot, and yet it really just kind of gives a checkpoint of, okay, I'm competent, I'm good enough, right? As opposed to it's much more complicated than that, but at least an awareness of these type of things. And then you also, even from the college and on up level, from master level programs, PhD programs, medical school programs, how do you actively recruit individuals that come from different backgrounds so that it's not as primarily white in terms of that. And that's where, like locally at UB with the medical school, they've done an active push to try to increase disproportionate and underrepresented individuals, and the numbers are pretty impressive even over a couple years. When you actively seek that type of population, how you can actually improve recruitment, and you get an entire different set of individuals with different life experiences, and it gets a much more culturally diverse background. So these are at least some of my broad thoughts on it.
I'm on the board for the Mental Health Association of New York State, and in 2017, we were the organization that got legislation passed in the New York State Assembly and Senate to have the first mental health education law in all of the United States. In other words, it was legislated that all schools, pre-K through 12, or K through 12, public schools, have to have mental health education in the curriculum. So it was worked through in collaboration with New York State Ed, and now all school districts throughout the state have to have mental health education. It is really based on the district. They're autonomous in how they make these decisions, but we've come such a long way. Now there's other states as well, I think Virginia and many others who followed suit. And that's a place to begin. I think when you talk about education and you talk about mental health, we have to teach and teach young and teach what it means to have a mental health condition, but also what to do if you have a mental health condition. One of the things that's great that we have where I work, it's a program called Just Tell One. And Just Tell One is designed to help young people between the ages of 12 and 26 understand how to talk to a trusted adult if they find they're struggling with depression, anxiety, suicide, substance use. And so we offer this program, and it's a way to, once again, educate young people. So it's through these programs, through these legislative programs, that we push this out. In addition to that, there's also a program called Mental Health First Aid. So Mental First Aid is a program that's sponsored through the National Council for Mental Wellbeing. I've been an instructor since 2014. There's a variety of curricula. There's an adult curricula, there's their curriculum, there's a youth curriculum. And these programs are for adults, specifically for the youth program, that work with youth, whether it be in schools or other programs. And the beautiful thing is that it teaches things at a level that anybody can learn this program. You don't have to be a clinician. But what it does is it teaches about signs and symptoms of mental illness. It raises awareness, addresses stigma, and there's even a cultural component that was added on in the second edition. So it also addresses the cultural piece. So really, from my world, once again, it's a lot about education, about just teaching as early as we can at a developmentally appropriate age so that this next generation is more aware. In fact, I will say, based on the conversations I've had with my team of peer advocates and even my own daughters, our youth are more aware of what mental health is, and they know really more about what these things are, certainly more than when I was their age. And I think this does actually give me a glimmer of hope for the future. But we still need to do more. There's still more room to grow. There's still stigma, and stigma is a major barrier. We talk about barriers. That is a significant barrier still in what we're dealing with in terms of all these things. So we need to also address the stigma that exists to make things better for everybody.
If anyone in the audience would like to ask one, we've got a question there.
I've been looking at the UUP resources here. I've been reading your research profile of information. I am from Buffalo, impacted by 514, a lot of other things. And when I looked at this roundtable in terms of what you're talking about, you're looking at structural racism, generational trauma, and the implications of mental health equity. Now I'm going to put the elephant in the room and take it a step further. What are your beliefs of the implications in the workplace environment? Because we are UUP. I feel a lot of people are here because we've either seen or experienced things through the past couple of years in our SUNY work environments that have triggered off things for us. And the hope is hearing from this panel about what suggestions would you have for the SUNY system in addressing what is happening in the workplace environment as it relates to structural racism, as it relates to generational trauma, as it relates to implications for mental health equity. Because I go back to a quote that I wrote down here at the beginning of this process, where it was mentioned that SUNY is positioned to do so. They're positioned to do so. But in being positioned, what's lacking is the will. So I would love to hear from each member of the panel as to what your feedback would be to us who visually see this on a daily basis or experience it on a daily basis. Because that's part of the reason why I know I came today. And I'm probably speaking for others. And if I am, you're welcome. And if I'm not, I apologize. But please talk to us about that, because that's what's impacting us personally right now.
I don't work in the SUNY system, but I am a university professor, and I'm also the Associate Dean for Diversity and Faculty Development, and our office was created 3 years ago, and the first thing I did was to hire a consulting company to come in and gather information about what is going on. They've done interviews, focus group sessions, and they're giving us surveys, document reviews, so that people can come by confidentially and talk about issues around racism, issues around vicarious racism, because in the workplace, people are impacted sort of negatively by not just what happened to them, but what they see happening to their peers. And so when they're done, they'll be done next month, we'll have a strategic plan that will help us. And we've also are looking at our policies and procedures. How are our policies negatively impacting students, faculty, and staff? Because it's not just being nice or having some training, but it is about looking at the policies that negatively impact.
Because if I'm yet another person that says this is what you need, that might be great, or it might be alienating, or it might be disincentivizing, et cetera. So, I mean, it almost seems like a little bit of a semi-cop-out answer, but it's not supposed to be. But just piggybacking off of what was said, I don't have a great answer to that, only because I don't know the problem well enough to. But I think if it's a problem that you and I'm sure others have experienced, then that's an issue. So we need to address it. We need more information before we can meaningfully address it.
But what you're talking about exists, I think, across many industries, not just higher education. You're talking corporations across the United States. And whether it be, of course, we know terms like microaggressions and bias. And these are things that have existed for a long time, but I think now more than ever, they're coming to light. And it's through, I guess you could say, it has to be, at least in my mind, a top-down approach. If you don't get the buy-in from the higher up, then it's not going to go anywhere. Because I worked in higher ed for 12 years. I worked at Genesee Community College. I worked at Buffalo State for 6 years, and I worked at Damon. It's now Damon University. So I know even higher education, there's a hierarchy. There's a tier-based system, and oftentimes things will come down from above, and and they call it the White Tower or whatever. But I think it has to be at a place where the administration needs to make sure that these things are put into place and delegate to whoever the appropriate personnel are on campus. Now, of course, diversity officers are very common these days on campuses, in many campuses across the country. But what is happening? What are they doing? I mean, are they just there as figureheads, or they're just there as just because it's nice to have one, or are they actually putting actual program into place? So I think what we're looking at is being able to take what's needed and make it actionable. And the university, she's going to retire. I'm happy for that. But she works in organizational development training. So I do know that she's done like safe zone training, and she's done other training that hopefully will get through and educate individuals that otherwise would not be exposed to this kind of education. And I'll say this last thing. Sometimes these programs are mandatory, and sometimes they're voluntary, right? So what's it going to be? And I think sometimes we need to just say, whether it be through incentivizing or finding ways to get the message across, because sometimes, I don't know about you, but when I'm told I got to do something, I might put up some resistance. But when I'm presented something that says there's value, I'm going to get something out of it, then maybe I'll look at it a little bit differently. So we have to maybe take I guess it's, let's say, the honey versus vinegar approach, if you know what I mean? Like in terms of how we present these things. So I think there's ways we have to be creative in terms of how we do this, but it is possible. But it also, you're talking about changing systems that are in place, like everything else we're saying, that have been institutionalized for quite a while.
In the work environment, the top-down approach is not only the people on the top being part of the solution, but who's at the top? So what we usually have when it comes to corporate America is you have all these movements to bring in diversity at the boots on the ground level. But then there is no promotion. And the few that may get promoted, then there is no support. There is no retention, right? So it needs to be, once again, a purposeful approach to, are you developing a workforce that is going to have a seat at the table, that is going to have a voice as to how do we develop a mental health support program for employees? Or are you just going to check that, okay, we have 8% are African American, 3% are Latino, and then we're good, right? I'll take it even a step further back. Governance. Who are your board of directors? Who is your board of governors? And what is their diversity? And when you go hire individuals, because we all want to hire diversity, I'll take it a step back. Who wrote the job description? Because job descriptions can be written in a way that leave people out. And then who reads those resumes? Because we know resumes get turned away because the name doesn't sound white enough or American enough, right? So we have to be purposeful about those issues of how we're going to do that. Now, overall, in works in corporate America, mental health care has kind of gotten a little more attention, and DEI committees have been created everywhere, but very few places actually make it effective. So there's a lot of DEI committees, but they can't do anything. They're not allowed to do anything. And then when you ask for safe spaces where people can actually raise their hand and say, hey, you know what, we need this, they have fear of repercussions. So, I need my job. I'm not going to rock the boat, right? So we need to provide safe spaces, but true safe spaces where people can speak up and have the ability to make changes that are going to help things move forward. If not, we'll keep having these conversations every year.
I think that's an excellent place for us to close. I want to say one thing related to your question. I'm joined today by two of my fellow statewide officers, our Vice President for Professionals, Carolyn Kuby, and our Vice President for Academics, Alyssa Carl. Alyssa comes from Brockport, and Carolyn from Stony Brook Hospital. In the past 6 months, 8 months, in our conversations amongst the officer corps, we have emphasized the fact that whatever we do in terms of our work to address as an institution, as a union, racism in our society, we have to be damn sure that we are a legitimate voice, which means we are undertaking a program, thanks to Carolyn's hard work in getting us a grant and putting together a program that brings in an outside firm that specializes in this work, that we will be undertaking training for our own members as members of this union so that we can come to terms with our own racism and the racism of the institution in which we work. And to confront that, this is a long-term project. It will not be done in 6 months, a year. In fact, as I continuously say, it has no end. It is better to think of it that way, that this is ongoing work and it is a major priority and it will stay as a major priority for this union. And I hear your concerns, and they are absolutely front and center. We must insist on addressing these issues internally as well as raising them in our university and in our greater society. I would like to ask the panel a one-word answer question, maybe 2 words if you want to throw an adjective in. And that is, are you optimistic or pessimistic about the future in terms of our society in dealing with the core issues that we have addressed today, which when it comes right down to it, yes, is racism and white supremacy. Dr. Davines, I'll start with you as we started with you to begin with.
I would say that I'm both hopeful and ambivalent.
I'm the eternal optimist.
Realistically optimistic.
Dr. Mancini stole my thunder. Eternal optimist.
I would like us all to acknowledge the brilliant panel that we have spent the last couple hours with. So thank you all very much for joining us.